So the meeting is not start until 7. So
7.
let's wait until a few minutes after 7 until we see.
Should we close the door?
No, that's okay.
You have to be right next to me the whole time.
No.
There's a few more people. Janis Black. Hi, Janis.
Welcome, Janis. Garrett's joining us.
Hi, Cynthia. Is that you?
Hi, everybody. Erin.
Then you see me above your
Hi,
head.
Cynthia. Hi, Garrett.
Hi, Erin.
We just see the top of your head, Cynthia. We don't see you. Yeah.
Here.
We have to play with it.
Here comes Elizabeth.
You don't want to watch?
I just listen.
Okay.
Hi, Elizabeth.
Hello, everyone.
Hello.
Perfect.
Welcome.
Hello, Chelsea.
When the meeting gets started, I think we'll ask everyone who's not talking to please mute themselves, so we can sort of hear.
Excuse
Oh,
me, don't you have control over that?
Don't you? Yeah.
Mute us all?
I do, but yes, I do.
I mean, you can mute
Yeah.
us all and then they unmute when they want to ask a question.
That's right.
But that was very
We'll
polite.
exercise our host's prerogative if we need to, but
If you just in case somebody accidentally hits the
Well,
the
sure.
thing, it'd probably be best to mute everybody first.
Sounds like a
Because
good
you're
idea.
going to hear from my two.
And then I thought you were gonna. We'll just raise a hand.
Yeah, just raise a hand like this.
Oh no, there's a way to raise a hand.
yeah, if you click on the participants button.
Well, I think, Dr. Levander, you should give your talk, and then after you give your talk, you should open it up to questions and answers. I don't think they should interrupt you during the talk, or do you care? What would you prefer?
Oh, no, it's probably a little easier if we mute it and just
Right.
Yeah,
because
and
there's
then
gonna be a
open it
bunch of
up to
people.
questions and answers after your talk.
Yeah, afterwards. Yeah.
All right, we're gonna mute all now, and then Dr. Levander, you can unmute
Well,
yourself.
don't mute me because I have to introduce them.
Well, you can unmute yourself.
Yes, okay.
Sharon, you have to unmute yourself now.
I'm going to wait until the screen fills up with more people. It should fill up with quite a few people, I think.
Yep. It's already looking like a nice turnout.
Yeah, good turnout.
We'll just wait a couple more minutes if you don't mind, because I think it's worth waiting so they can hear you in totality, Dr. Levander, so I can hear the whole talk.
Well, we might even give them a couple minutes after 7 because, you know.
Yeah, I
sometimes
think we
we'll have
should.
a little
I think we should give a couple minutes after 7.
Yeah.
Actually, Sharon and Dr. Levander, I'm going to leave and come back on a bigger computer so I have a
Sure.
video.
Sure.
Okay, so I'm
Sure.
going to
Hey, Marlene.
Hi, Marlene. Hi.
Be right back.
It's the most interesting thing, this Zoom, isn't it? As we look at it, it's just interesting. It's so different.
Sure is.
What did I miss?
Thing, I'm just waiting for
Just letting a couple more people in.
to sign on.
Oh, Gigi.
Look at this nice full screen.
Yeah.
Yeah, Gigi. Hi, Gigi.
Hi. Hi.
Zebra.
Hi, everyone.
Hi.
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 We don't see your picture, Zebra, but we.
I know, I'm going to get ready. I'll get ready.
You're not camera ready?
I'm not camera ready.
Yes. Yeah, just.
Tim, is that you with the NAMI logo?
Yeah, do you like that?
I like seeing you better. Hi, Susan. How are you, Susan?
Hi, Sharon.
Hi, honey. Yes.
How are you?
Yes, Terry, we can see you now.
I'm back now.
Yeah.
Hi, everybody.
Let me just mute this telephone. Yes.
To the people who just came in, we're gonna mute you or ask you to mute yourselves as we get ready for Dr. Levander to talk.
Okay. It's a minute or two. It's a minute or two after 7. Should we wait a couple more minutes, Tim, or should we begin?
Maybe 60 seconds. The countdown has begun.
Yeah, that's okay. Because I think this will fill up much more.
Mhm.
Hi, Jeff.
Hi, Maddie.
One more.
Can you hear me, Annie?
Yeah.
Can you hear me?
Uh-huh.
Oh, okay. You look like a teenager. You're so cute. I guess they want to unmute. They told us to unmute when the doctor starts talking.
Yeah, they're gonna mute us all. Yeah.
Okay.
Or you could do that. We don't like having to mute people. Doesn't feel
Okay.
right.
All right.
You have a couple more people joining us.
Hi, Doug. Hi, Doug. See your face there.
Hi, Doug.
Sharon, what do you think?
I
You got
think we should start. I expect many more, but they'll just come on.
Well, we've got 30 people now, so
Do we have 30? It doesn't look okay. We have 30. I think we'll have
It looks like 9, right?
what? Yes.
It looks like just 9, but that's because we're
no,
on playing
it looks like-
Hollywood Squares.
It looks. I have 15 squares on my screen, so
but there's an additional screen now.
I actually have 25 on my screen. So, welcome everybody. This is NAMI Westside LA May speaker meeting. We have an esteemed psychiatrist with us tonight. I just want to, before we begin, I want to compliment Tim Davis. and Erin Ryan, our executive director, on all the work they've been doing to offer our free classes, our speaker meetings through Zoom. We're even offering Ending the Silence to libraries and high schools through Zoom. So, to fight stigma among young people so they feel more free and open to talk about issues with their brains in the high school years, because if people pay attention when they're young, we can really lessen the impact of these illnesses as they go through life. So I just want to compliment my staff, Elizabeth and Erin and Tim Davis, who are doing such a yeoman's job of fighting stigma and normalizing mental illness. It's a mental illness like any other, and it should be treated like any other illness instead of isolated and stigmatized and having less available treatment. So we are very fortunate tonight because we have an esteemed psychiatrist with us, Dr. Nathaniel Levander, and is it Eric or Nathaniel?
Eric.
I've always called you Eric, but when you signed on, it said Nathaniel.
No, it's Eric.
Yes, okay. So Dr. Levander is an esteemed psychiatrist. He's an associate clinical professor of psychiatry at the David Geffen School of Medicine. He's a distinguished fellow of the American Psychiatric Association, and he has spoken on several different occasions through the many years that I've been president of NAMI. He's often spoken on bipolar disorder and the issues therein and the medications. I have referred several patients to Dr. Levander. They all feel comfortable with him. They feel he understands medications and he makes them feel comfortable. So I feel very safe referring patients to Dr. Levander. So I welcome you, Dr. Levander. Thank you so much for joining us tonight. And I know you're going to talk on our emotion, or how to handle our feelings during this time of isolation and separation, and kind of what we can expect from ourselves. And what feelings are normal and what feelings maybe we should address. So thank you so much. We really appreciate you coming and giving up an evening to be with us.
Well, I really would like to thank NAMI for inviting me to speak to everybody here. I first want to acknowledge the importance of NAMI. NAMI West LA, as hopefully many of you know, offers free education programs along with support, guidance, and hope for the many people in Los Angeles who are afflicted with and affected by mental health conditions. Mental health conditions have always been difficult to manage. Fortunately, through the efforts of NAMI and other similar organizations working to decrease stigma and recognize the signs and symptoms of depression and anxiety, now with things like Zoom and other kinds of devices, hopefully we have a chance at managing the difficult emotional toll that COVID-19 and the quarantine will place on us. In a way, there's two kind of problems that I see. One is just the tremendous fear, the fear of financial problems and the fear of catching COVID-19 or giving COVID-19 to somebody that you care about. The other issue that is really problematic is the isolation that we're all suffering from. Especially for people that live by themselves and they have very limited interactions with other people. And things like this, that you are here now, is important. And there are other kinds of events like this where you would be able to interact with other people. And I'll go over this in a little bit. My hope is to give you a little bit of perspective about COVID-19, not to scare you, but to hopefully give you a little bit of education just because I think there is a lot of information out there that can be scary and frightening. And then I want to talk a little bit about how COVID-19 is this crisis that we're dealing with is a bit like dealing with grief. I'd like to then delve into better strategies to dealing with COVID-19 or coping with COVID, and then talk a little bit more on when you might want to seek out mental health treatment, and then open it up to questions. I have always thought people that that preceded us knew a thing or two. We do not need to create the will. People have long dealt with pain and depression and suffering. And there was a rabbi in the 1700s named Rabbi Nachman of Bratslav who wrote something that I always find very grounding, and that is the whole entire world is a very narrow bridge, and the main thing is to have no fear at all. And we're crossing this bridge right now, and it's an experience and an unpleasant one. And we need to do it with our walking one step at a time and trying to dispel the fear. I think FDR said it pretty damn well. There's nothing to fear but fear itself. And I think that is very true right now. So, everybody's talking about how this is an unprecedented time, and in a way it's gotten cliche, and in a way it's kind of scary, like it's unprecedented, we don't know. And yes, while it is unprecedented, we've never had anything quite like this, and it is scary, it's important to remember several things. One is we have a lot to learn from other events where we do have experience to fall upon. And two, we're going to survive this. Humanity has faced severe crises in the past, from the genocides of the Native Americans to the various slaughters that have occurred in Western Europe and in Africa and in Asia. One of the most tremendous experiences I had was on the top layer of Angkor Wat, sitting there just admiring the beauty of this place, when a man came and sat next to me and talked to me and told me, just talked to me about how his parents had died in front of him and all sorts of difficult things. And here he was talking with me and having a meaningful discussion with me. We will get through this. We are still in the early stages of this emerging infectious disease outbreak. And there, unfortunately, is a great deal of uncertainty about the nature of the disease, its spread, its scope, and its impact. Our leaders are being buffeted by a variety of different concerns. There's the concern of deaths caused by the illness. There's the concerns of the morbidity or the problems with getting sick. And then there's financial problems that and the problems of isolation that can cause other issues. So such an environment creates a lot of conflicting news. And conflicting news can cause a tremendous amount of significant and understandable emotional distress. My friends texted me a pretty funny op-ed piece in the New York Times, funny but not so funny, that really goes into this. It was from the last day or two, but just like all these questions and back and forths, and it really does create a lot of uncertainty. I've had family members send me urgent, frightening emails about news at different times of the day or night when they happen to be scrolling through things. We're 6 months into this, and we still have a tremendous amount to learn about this. And never in our lives have we been able to learn as much as we have in such a short period of time. It's unbelievable. I'm talking with a variety of medical experts, some of my former professors at medical school, and I'm just, we're just marveling at the rapid pace of change and how quickly we're finding out things. It's a this is a very scary issue, and yet it's important to take a step back and take a more realistic perspective and not feed into the fear. We all, however, mourn the tremendous number of people who have died and feel for the people who have managed to pull through the illness and are still recovering physically from the injury caused by the virus. Health resources are being overwhelmed all at once, but fortunately, at least here in California, the tremendous influx that was predicted has not happened. And I think we can thank the governor, Governor Newsom, and Eric Garcetti, and the other mayors of the other cities in Los Angeles, and the medical director of infectious diseases for the county for this fantastic job of leadership. It's easy to cast blame and whatnot, but they've really kept numbers down tremendously. Unfortunately, the financial stressors are such that we can't just stay in quarantine all at once. Nonetheless, remember, we all need to wash our hands, wear masks, and maintain physical distance from other people. And I'm probably going to touch my face, so whatever, but try not to touch your face when you're outside. It's fine here, but not out there. One thing I think that can be a little bit frightening and scary is when you see what's called the case fatality rate, and that's different than the infectious fatality rate. The case fatality rate is the number of deaths that occur amongst people who are diagnosed with the illness. The infections, and that's that's the numbers that you can see and get published. The infection fatality rate is what we don't know. How many people have been infected, and how many people, the same number of deaths over how many people have been infected. And that rate is tremendously lower. The one thing that we do know is that age is one of the biggest predictive factors, and female gender it tends to be protective. There is something that just came out in the journal Nature last week that says that progesterone may be helpful. So that may explain the gender differences, but who knows? We still don't know. But age is certainly one of the most predictive things in terms of injury and severity of what will happen. And so, you know, that is going to be an important thing for us to keep an eye on. Tests are currently being developed that are going to allow us to get a better idea of the actual number of people who have the illness, and allow us to really know in a better sense the actual infection mortality rate, which is going to be a heck of a lot lower than the case mortality rate. There are two kinds of tests. Tests that can tell today if you have the virus in your nose, and then there's the other, and that's called a PCR test or an RNA test. And then there are tests that can determine if you had the test before 10 days ago, and that would be an antibody test to test if your blood has antibodies to COVID-19. That's true for all illnesses. And we're still trying to develop those tests and trying to figure out how accurate there are, because you don't want to have a test that says that with false negatives that says that you didn't have the illness when you did, and you don't want to have false positives that say that you did have the coronavirus when you didn't. And so that's still in to be determined. Many people, you know, the people who have been tested thus far primarily have been sicker people, and so sick people are more likely to have a bad outcome. So it looks a lot worse than it is. That said, it's still something of concern, and we need to live our lives and not live in fear. To summarize, while many people are dying and our resources are taxed, we're doing an okay job in California. Hopefully we will continue to get protective equipment and better testing to be able to really determine a lot of, first of all, if people have it, and then to do tests to to identify people who are currently infected to get them isolated. So now I'd like to talk a little bit about quarantine. Fascinatingly, the term was first used in Italy in the year 1127 when ships arriving to Venice from infected ports, and I don't know what the infected ports were, but were required to sit at anchor for 40 days before landing. And the practice called quarantine was derived from the two Italian words, quaranta, which means 40, and giorni, which means days. So what quarantine it's derived from is 40 giorni, or 40 days. Who knew? And in a way, we've kind of been doing this sort of biblical thing here. Actually, it's 8 weeks, so it's almost, we're doing our quarantine. The CDC defines quarantine as a separation and restriction of the movement of people who are exposed to a contagious disease to see if they become sick. So, and that's what we're doing. There have been many quarantines over the last 10 to 20 years. I'll name a few, and you probably have only heard one or two of them, but there was something called equine influenza, which was pretty dangerous and fatal, Ebola, SARS, and MERS. And there have been a number of studies that have looked at the mental health concerns of this, 24 studies looking at almost 20,000 people to evaluate how people cope. Just one thing to note is, I think after this all ends, it's going to be really important that we all lobby our representatives to beef up the public health network. One of the things that Sharon didn't mention, but that's okay, I have a master's in public health from UC Berkeley, and you know, this is these kinds of things. It's fascinating. If you look at clean water, having clean water, purifying water really caused a drop in mortality rate. And I think this is for polio. And then came the vaccine. So really measures like cleanliness and washing are key and important. And having contact tracing and having a great foundation is going to be helpful. And that's some of the things that are going to be expanding over the next, hopefully, weeks to months. Quarantines, so some of the things that these 24 studies showed is that quarantine is an unpleasant experience for most people who undergo it. I can't imagine anybody here is really rocking while we're in quarantine. And so, you know, lo and behold, many of the people who were in quarantine experienced anxiety and fear and irritability, poor concentration, insomnia, depression, sadness, exhaustion, and detachment from others. You know, one of the things that's important to recognize is that people who have histories of significant psychiatric disorders are possibly more likely to experience distress after a trauma. And, you know, it's going to be really important to manage differently this trauma. So I've talked a bit about the illness and about quarantine. I'd like to talk a little bit about how processing this experience of quarantine and the economic fallout is a bit like being in mourning. The 5 stages of grief, which are denial, anger, bargaining, depression, and acceptance, was outlined by the psychiatrist Elizabeth Kubler-Ross to describe the emotional journey for the death of a loved one. And taking a look at that, we can sort of use this as a map to help us as we transit through these uncharted waters of the COVID-19 pandemic. Denial affects us all. Certainly, we see a bit of it with the protesters who are out on the steps of our Capitol without masks on and shouting out that this is communism. It's not. Public health measures have nothing to do with people deal with financial and political matters. This is about saving lives. But denial affects us all. It's disbelief and it's resistance to the facts. This can't be happening. And it's adaptive as it permits us to navigate a dangerous world full of unpredictable threats without becoming paralyzed with fear. And so hopefully we can all take a little bit of solace in knowing that this is an understandable kind of thing, this denial. Once denial changes and we read the news and our anxiety turns to anger and fear, anger is the next stage of grief. And many of us have experienced this, blaming politicians, our medical system, the lack of toilet paper, the fact that when I ordered some toilet paper on Costco for a family member, and if you order it on Instant Cart, it'll give you another option. If this thing isn't available, you can may we suggest this, and the suggested replacement for toilet paper was almonds. So anyways, but that's a little aside. So the next stage is bargaining or making trade-offs. We realize that in order to make it through, we need to sacrifice. We've realized the potential harm of this pandemic and the need to enforce physical distancing, not social distancing. We need to maintain our social connections, but physical distancing through closures of restaurants and in-person NAMI meetings and the shelter-in-place orders that have turned Los Angeles into a ghost town. And figuring all of this out, and in a way right now, dealing with the opening up in a sense is a bit of this bargaining. And then one thing to really pay attention to is depression or feelings of hopelessness. Fears about how we're going to pay our bills, what will happen to our jobs, our businesses, our connections, and taking a look and acknowledging that. And then finally, the last stage of death, according to Elizabeth Kubler-Ross, is acceptance and exploring options and moving on, needing to act decisively in order to save lives. Now, all of these stages of grief happen in different orders. They don't all happen at the same time. We can be in acceptance and then go to anger and go to bargaining and then back again to depression. So I think it's important to talk about this because it can really help you understand that we're all having these really difficult feelings swirling around. And these are the same kinds of things that we experience in mourning. These are the same kinds of emotions and reactions to incredible stress that human beings have had for millennia. And we will continue to move on after this. And I'd like to talk to you now about some of the ways to deal with it and to spend a bit of time talking about coping with COVID. And as I mentioned, all of your feelings are normal. They are to be expected. Like who wouldn't feel, I think about, I've heard interviews of people who were in the, I can't remember the name of the prison, one of those awful prisons in Iran, suffering, like a journalist who suffered torture every day. And I can't imagine. And here I am having a pretty tough time right now. I spent a bit of time, so it's just, these are normal emotions, and who wouldn't feel anxious about a pathogen that can't be seen, and you don't know if you have it, and was that cough that you had COVID, or was it allergies? I don't know. And with people who have already struggled with anxiety or obsessive compulsive disorder, this may just be a bit of real difficult time, and it's going to be hard. But I think importantly, we have to stop and breathe. And I will tell you that I'm in this too. You'll see there's also a New York Times article about therapists dealing with the anxiety of this and the depression of this while they're talking to their patients. And I'm going through this too, and I'm working to the things that I'm talking about are the things that I apply to help out. The first thing I think that can be helpful is dividing the world and our choices into two categories, that which we can control and that's which we can't. Uncertainty is the perfect petri dish for anxiety and worry. It just is. That's what anxiety and worry are, uncertainty. And we can't know or control how long this will go on or how bad it will get. We can't control the actions of leaders. We can't control if other people hoard all the toilet paper. You know, these are all really things that we're just gonna have a hard time figuring out. And these things stink. Nobody likes them. These, and some of these disruptions are necessary for the safety of our community. When I go to the supermarket early on, when I went and I saw the line of people and no toilet paper, I too got frightened. But it's important to take a step back and not focus on these uncontrollables and focus on the second category of things so that we can control, by the way, including our breathing. So, you know, Viktor Frankl is a noted psychiatrist, neurologist, and Holocaust survivor. He was in several concentration camps. And he wrote that everything can be taken from us except our freedom to choose our attitude about a given circumstance. Now, I don't know that we can necessarily say, I want to be happy about all this and I don't choose to worry and whatnot, but we can work towards that goal of choosing that we want to go on that path and focusing over and over again to going on that path of solace, and focusing on things that we can control. So while it is difficult to follow through on a path that's less fraught with fear, we can work through a series of steps to try and walk down that path. Asking continuously about how long this will last or what we can do will only send us into a frenzy. I'll say, you know, I don't watch, Sharon, you were commenting about how I don't have a TV. I don't watch TV. I don't have CNN. I don't have MSNBC. I don't have those things on all the time because it's a lot of people with a lot of different opinions. I will say that this is one of the things that's so difficult is hearing an expert on TV with a lot of letters after their name or an expert on this or that, saying that this is going to happen, followed 5 minutes later by a different expert saying that this is going to happen. I can safely tell you that I have had plenty of circumstances where I have diagnosed somebody with something and one of my noted colleagues who is also a really heavy intellectual and knows their stuff has come up with a different, equally well-informed diagnosis or plan. And so like this goes, the same is true for what you see on CNN. People are gonna really come up with a variety of different you know, possibilities, and focusing on them can be really difficult. The other thing I try and do to get a sense of this is to think of this as an experience that I'm going through rather than throwing myself into the ocean and getting caught up in the waves. When my father was dying, I called one of my professors on how to manage the stress of helping my father die. And he was incredibly helpful, and he reminded me of things that I knew. We all know these things. Think of this as an experience. Don't get caught up in it. It's like a roller coaster, and by this, we're gonna be going through a tumultuous periods. We're gonna have ups and downs. I do. Yesterday, I read some stuff that really that was really upsetting for me, and then I had to pull back, and I'll talk about that a little bit later. And then focusing on control, and I'll talk a little bit more about it later. We can control when we go to bed and when we wake up. Not always the case if we got insomnia, but focusing on that, and there's a whole host of really good things. You can get a book called Say Goodnight to Insomnia if you're experiencing insomnia with this, and you can talk to your doctor or mental health professional about this as well. So we can choose, we can control when we go to bed. We can mindfully wash our hands, wipe down our doorknobs. We can control how much news we consume and how we engage with people on social media. We can choose to reach out to others, to supportive people that help improve our spirits, and stay away from those that drag us down. We can be kind, and we can savor the time spent with family. One of my patients told me that despite the fact that he's out of work right now, he is spending a lot of time with his 13-year-old son, and that's really meaningful for him. And he's doing okay. So even if we're sheltered in place, we can still go outside, enjoy the sunset. It still hasn't quite set yet. I'm looking outside behind the screen here, and spring, we're in late spring with flowers all around us. We can focus our, we can attempt to control our focus from the irrational to the rational. Early in this crisis, I was beset with a huge amount of fear, and it was a difficult, dark time for me. I had to stop and write down my crazy fears. I wrote them down on a sheet of paper, and then, my health is going to be affected. So many people in my community would die. I'd lose my house, all sorts of things. I was completely panicked and overwhelmed. And for many years as a human being and as a treater, a provider, I know that simply writing things down, simply writing down that I'm anxious, and writing down my fears can be helpful. I wrote down my fears that the world is going to fall apart, and I wrote all that down, and then it got a little less daunting. And then I wrote down another column that responded to those fears in a realistic manner, realistic appraisals of those fears. And while I can't say I was skipping through the streets the next day, I was able to go to sleep and wake up the next day with a fresh perspective. And interestingly enough, by doing this and continuing to manage it and water it, I'm sleeping better than I have in a long time. And I don't have to deal with traffic anymore. I really invite you to attempt to take care of your fears and anxieties like this, because it can be helpful. These fears, and just writing it down once doesn't mean it's gone away. They're going to come back. I'm going to see something else. And I really do attempt to practice what I preach. One other thing that I found kind of fascinating, on March 20th, I wrote that May 1st was my estimated date that the quarantine would end. I was wrong, and I'm glad that I wrote that down. I was wrong by 2 weeks. But the thing that's really kind of interesting is, look, things are not going to be good. There's going to be a lot of people are going to suffer. There's going to be a lot of deaths. There's going to be a lot of financial problems, and there's going to be a lot of stress. And when I see it in paper, in the newspaper, it kind of takes my breath away. And the first thing I need to do is tell myself, you knew this. We know that there's going to be problems. And rather than looking at it like, oh my God, this is happening, it's like, yes, this is happening, but we're going to get through this, and we're going to get through this. We will all get through this. I am limiting the amount of time I'm online looking at news, and I only go to trusted news sites. I hate when people send me like weird things from some weird magazine that proves some weird topic. I don't read it. I just don't read it. And I only allow myself half-hour time blocks to read the news. I exercise every morning, and I won't look at the news until after I exercise. And then I go for a walk around now to help me settle down from the day. I certainly don't look at news within the hours before I plan on going to sleep. That is verboten, because then I'll end up ruminating about it. And this is not just me. This has been this goes through the one piece that I really got out of a chapter that was released. There's a textbook on disaster psychiatry, and they let out the pandemic chapter free, but that's online, but it's limiting media exposure. Research has shown consistently that excessive media exposure increases negative mental health outcomes. Seeking support from other people, from connections with friends and media, and schools may have some additional ways to stay in contact with educators and classmates that are going to be important. Email and texting can be important. Be careful with your use of social media, because sometimes that can heighten fears if there's a lot of negative articles that your friends are posting online. Stay away from alcohol and caffeine, only in the morning. Not alcohol in the morning. Stay away from alcohol and drink caffeine only in the morning. Stay away from substances. Talk to friends, and get dressed. Dress for the part. Don't stay in your pajamas. Establish a routine. Bathe regularly. And one other thing that can be helpful is if you want to worry, schedule worry time. Give yourself 15 minutes or 30 minutes twice to 3 times a day to worry, and allow it to go then. And you really have to do this. And I was surprised when I first heard of this technique. I'm like, how is this going to work? It works. I tell myself, no, not worrying now. We'll do that later. Things are going to work out okay. You knew this. Let's worry later. And it can be helpful. Some other writers wrote about the 3 C's involved in that were helpful in dealing with resilience. And resilience is something that was studied after the 9/11 attacks. And those are control, which I've just talked about, just in terms of like taking your medicines as prescribed, sleep, bathing, checking in on friends, writing a journal, coherence. And this is important, developing a coherent narrative of what's happened. Not fluff, not saying everything, we're like, and I'm not saying everything's going to be all right. I said we are going to move through this, and we will get through this, and we will be okay, but not saying this is a lot of fun and games, but really having a logical narrative of what is happening. There is the UCLA Mindfulness Center, which is marc.ucla.edu, and they have an app for your phone. It's the UCLA Mindfulness app. There are some apps there that can really help with this, because being able to take a step back and not get caught up in all of this, and really having a story for yourself and a mindfulness to be able to see how the fears affect you, to see our reactions to those fears, can help provide a coherent narrative to what we're going through. Lastly, the last third is connectedness, and that is, thank you all, NAMI, for inviting me here, but being able to do this and is a way of connecting and staying connected to other people. There are religious organizations have these kinds of, will have services online and connections. NAMI has, how many days, we'll talk about that later, but I think at least 4 or 5 meetings a week that you can connect with other people, and then just reaching out in as whatever way you can to friends and family. I want to talk a second about, in terms of other things to help improve and maintain coping strategies. One thing is in terms of if you're in a romantic relationship, it can be very stressful. And successful couples are ones that look for things that their partner is doing right, not what they're doing wrong. And so now would be a really good time to thank one's partner and acknowledge the things that they are doing. So simply like thanking for somebody for making them a cup of coffee, or putting their dish in the sink or in the dishwasher. And really working hard to ban the criticism that can occur, and express what you need rather than what you resent. The other thing that can be really helpful is having a stress reducing conversation where each partner actively listens and doesn't try and solve those problems, but just say something like, I hear you're pretty stressed out by X, Y, and Z, rather than, oh, we need to fix this or that. I think it's really important that we are social creatures and we depend on each other. Don't try and solve other people's problems at this time. This is true for dealing with children. And we need to focus on our kids by encouraging questions and helping them understand what's going on, like we know what's going on. Talk with our kids about their feelings and validate them. Help them express their feelings with activities or drawing or just sitting with them, and helping them clarify misinformation, because there's a lot of misinformation out there, and providing hugs, comfort, and patience, and checking in with people. This is true for our friends and our kids and our partners. Kindness, appreciation, and listening are really important in maintaining our relationships. Lastly, in terms of other things, as Jack Nicholson said in The Shining, all work and no play makes Jack a dull boy. We all need to take some rest and relaxation from our worry to help us with this. Reading about COVID won't help with this, and maintaining that social network, and looking at different kinds of online forums for media. There's plenty of good shows out there. Saturday Night Live has been lovely in highlighting how difficult it is. What's his name? The really great guy who came out and talked about his own having a borderline personality disorder. Young guy. Anyways, he and Adam Sandler did a great song 2 weeks ago about dealing with COVID. Lastly, I want to talk a bit about mental health. This is a mental health forum. Sadly, once again, mental health issues are kind of at the back of the bus. Yes, it is important. We really must maintain protective equipment and ventilators and whatnot. But it's really important for everybody here to recognize that one of the really big problems of this quarantine will be the mental health problems that could occur. It's really important. Some of the things that I suggested can be helpful, but also reaching out to your therapist, your psychiatrist, to maintain those links and connections to be able to pull through this. It's a stressful time. It's important to recognize some of the symptoms that can come up. Fear, insomnia, difficult concentrating, certainly thoughts of suicide. NAMI is working on a 911 for mental health emergencies. We don't have that right now, but I think there's a crisis text line that you can talk to 741-741. All these, I'm pretty sure, are on the NAMI website, and there's a National Suicide Prevention Lifeline. And there are people there 24/7 that can help us. If depression is an episode where people have sadness, thoughts of suicide, insomnia, lack of pleasure, hopelessness, and helplessness. Panic is severe anxiety attacks with hopelessness and agitation. People can get manic now. One of the problems is half of the world is wearing masks. That can increase people's paranoia. Talking over these kinds of forums can be really frightening for people who are worried about people monitoring them. And so it's really important to reach out to mental health professionals if you're experiencing any of these kinds of issues. And so I've talked about COVID-19. I've talked a little bit about what it means to be in quarantine. I've talked about some strategies to I talked about grief and how it's like COVID. strategies to dealing with it. And really, I think the one important thing is managing your mental health sooner rather than later. And now I'd like to open it up to questions. I don't know how, because let's see, we have a number of participants.
Tim, I think you have to unmute everybody, don't you? Because the host.
Actually, everyone can unmute themselves. They can hold down the space bar when they talk, or they can just push the unmute button.
So the one thing I don't know about is I had thought that people would be able to raise a hand, meaning there's a way to let you know. So if you click on more, raise hand, and then you would know, because otherwise I might get 5 people asking a question at once.
Well, I can kind of monitor this, and I can go, who's next and who's next, because I can see everybody, and I think raising hand will be a good choice.
Okay.
So any questions or any comments, and I will call on you.
Does everyone know how to raise their hands? You click on the participants button at the bottom of the screen, and you'll see a panel open up, and then I see Chelsea G raised her hand and Darius raised his hand. So we've got some folks who are figuring it out.
If you're on an iPad, which I am, if you click on more, you'll see it says there's 3 dots and it says more, and down there it says raise hand.
Sharon, just because I can see it, do you mind if I just call on them and I'll let them know?
I don't mind at all. You go right ahead and do it. I can see it too, but you go ahead and organize this.
Well, Chelsea G is at the top of the raised hand list, so why doesn't she go first?
Okay.
My computer froze, or my iPad's frozen, but I think you called on me.
Yes, we did. We can hear.
I just had a question if this will be like published somewhere after, because I think I have a lot of friends and family that could utilize this, and it would be really good for them to hear right now. I noticed it's being.
Well, we didn't really record this because of privacy issues.
No, we did record it. We talked with Dr. Levander about it. Erin, I'm sorry. Go ahead.
No, that's okay. Chelsea, thank you for bringing that up. It's such a great point. And as we were listening to your speech, Dr. Levander, we were so grateful that we are recording it because it's such a great resource. And so we will share this on our website, so people will be able to review this and listen to it. I mean, it's just a phenomenal resource, and also kind of just such a historical piece of content that we will always have for this time period that we're experiencing together. So thank you so much for sharing. And Chelsea, thanks so much for bringing that up. It's a great point.
And thank you so much for recording it. I wasn't aware
Thank you.
Darius, you have your hand up. Darius Borhan.
Hi, Dr. Levander. Hi, everybody. Unfortunately, I'm speaking to you quarantined. I'm not allowed to go to any Starbucks in the West San Fernando Valley for undisclosed reasons, I guess. But I wanted to ask about somebody that my mom, I read his book myself, Dr. Amador. I don't even know he's a real doctor. Is he a doctor? Is he not a doctor? Whatever it is. He wrote in his book that psychiatric hospitals are benevolent, paternalistic institutions. And he wrote a lot of other stuff that, I don't want to waste our time talking about, but
I really recommend
that's something that happened to,
I
was a psychiatric hospital. It wasn't benevolent, it wasn't paternalistic, and now I have a bunch of marble lights in my room.
Sure. So Darius, thank you for that question. And I think, it sounds like you've read an interesting book. I'm not aware of it, but so certainly there's a whole discussion about paternalism and whatnot in psychiatry and hospitals. But right now I wanted to keep the questions more geared towards the quarantine and coping with the crisis right now that we're experiencing. But thank you for your question.
Hosts actually don't have the option of raising hands, so I'm just going to jump in here if I could. It was so interesting that you said set aside time for worrying, because that sort of runs counter to what I've always thought about worrying, which is try to process it, move through it. but I really like that idea. And I wonder if you can talk a little more about how, and maybe I missed it, but like, how do you do that? What does it look like? How, I think you give yourself 20 minutes and do you hold a pillow up and scream into it, or what, how do you do that?
You channel the Yoda inside of you. You know, it, like when I first read this, I gotta say, I agree with you. I was like, what the hell is this? Set aside time to worry? What? I'm Jewish. This doesn't work. Set aside time to worry. It happens all the time.
Worrying all the time. Yeah.
No, that's not true. And actually, it's like a really difficult kind of mind bend thing. This is not all of the time. And I want to be really clear. This is very important. For people with anxiety disorders, severe anxiety disorders, this is not something that you could easily do, but you can make it a little bit better. So I want to be clear on this. And so I'm glad you're asking that question. But if you're, and I don't mean to, with my comments, to belittle anybody or whatnot, but this is, it really, it's a difficult process of saying, I am worrying now, I need to set that aside from now and then go back into what I'm doing. It's a process that I have to do over and over and over again. And it's the kind of thing, it's like riding a bike in a way that sometimes people can get and learn. But the harder you're dealing with anxiety, the more anxiety times that I would set aside. And during that time, just allow your brain to go crazy.
Do you do that in solitude or?
Yeah, I mean, like from 5 to 5:30 at night, that's your worry time. And you just wait till 5 o'clock and then just start writing everything down that you're anxious about and worried about, and just let your brain free flow with worries.
And the other times, I'll try and do things that can establish a sense of control, like, you know, tying my shoes, using the UCLA mindfulness app, writing down my worries and writing down realistic appraisals of those worries. So, yeah. Does that help?
Yeah, very much. No, and I'm looking forward to trying it and limiting it to 20 minutes. Terry Cheney has her hand up.
Yes, thank you, Dr. Levander. This was very interesting, and I'm so glad to know the meaning of quarantine finally.
Yes.
I appreciate that as a writer. You mentioned there was a textbook on disaster psychiatry that had a quarantine chapter online. Do you have a site for that?
It's under cambridge.org.
Okay.
www.cambridge.org. I will say, it's not too informative.
Oh.
Like I was like hoping, I was hoping to gain some pearls that I would transmit to you guys, and it wasn't that helpful. I knew all the stuff before.
better to reread Viktor Frankl instead.
Yeah.
Okay.
Yeah.
Thank you.
Sure.
Susan Bracey. Susan, can you unmute yourself?
Can't hear you.
We can't hear you, Susan.
Oh, you can't hear me?
Now we can. Now we can.
So my son, who struggles with dual diagnosis, substance abuse and anxiety, depression, borderline, he's in a sober living, and this quarantine is really, really weighing on him. Just being bored to tears, not being able to go work out at a gym like he used to let off steam. And, you know, I really feel for him. He's just really struggling. So, you know, I know he's probably struggled, and he said he struggled with wanting to use again because of it, because, you know, he's just bored, so bored, you know. So any suggestions from you or the group on things that people who struggle with, you know, mental illness and sobriety can do during this very difficult time of just sitting around the house all day, not being able to work, not being able to do anything?
So, you know, this is one of the other kinds of things, and I think it's important to educate him on this very fact. This is one of the things that is incredibly difficult about this. And this is one of the mental health consequences. Substance use disorders are going to increase. That doesn't mean that we can't work, that you can't work to help your son, but just let him know that the experiences and the urges that he is undergoing is completely normal and to be expected in a way. The challenge is making that choice and attempting to, and not shaming himself if there is a relapse, but really working to maintain his sobriety. You know, look, I think I heard an interview with Ken Grimes and Marsha Grimes, the mystery writers, and it was on National Public Radio News. You can download it or listen to it. It's an interview with Scott Simon on the morning edition Saturday, and Ken Grimes said something like, you know, the difference between being an addict in recovery and being a normie, somebody without a history of substance use, is every time you have a problem, you start to think, if I only had a drink, if I only had a fix, I would that would solve this problem. And Ken Grimes said, the thing that I need to tell myself is it's going to only make it that much worse. And it's a thing that substances lie to us. And it's really important to really work and get him back into the steps. I don't know if he's in a 12-step program. There was recently data from the Cochrane Journal that looked at, did a meta-analysis on Alcoholics Anonymous for the treatment of alcoholism, or alcohol use disorders, I should say. And the AA was tremendous. Far beat any other kind of treatment program. It's going to be hard being in a sober living house where other people there are anxious too and dealing with this. In terms of activities,
that's right.
In terms of activities, you know, really trying to stay away. There's the LA Public Library is lots of free streaming content, including documentary films and movies. You can go to the LA Times website. I think they may have some free resources. I'm not sure, but there are plenty of media streams that are obtainable for free. We can't just sit in front of YouTube all day because that will make us bonkers. I'm glad your son works out. I work out. I work out at least once a day. I need to. It's part of my mental health routine. I mentioned it briefly, but I'm glad you're mentioning it, and I want to highlight it. It works for me. I don't expect it, you know, and I know that AA has meetings over Zoom too. And so that can be a helpful thing. I don't know if he has a sponsor, but, and I don't know how that works if you're able to get a Zoom sponsor, but certainly staying connected. This is all about a community and you being there and telling him how much you care about him and offering your support. But thank you for that very important question.
Yes,
and that's a lot too, by the way, I will say, just doing that.
Thank you for sharing that. When you were talking about community, one of our community partners, UCLA, they have a great toolkit that's available online, and I actually put the link in the chat box. So they're offering a toolkit with their Depression Grand Challenge. And so it has actual physical activities that you can do. So that might be something that's really helpful as well.
And there's tremendous, I mean, like, who knew, right? You need to like a study, but there's a lot of evidence that that exercise can be pretty helpful. And there's, like, you know, people laugh, but the 4-second high intensity interval training, if you could do something like that for a little bit, a couple times a day, even 4 seconds. You know, when I was in my office building, I would go up and down the stairs a couple of times. And that really helps. So. Sorry, Tim, I think you were saying something.
Well, I just was also going to say that I'm a member of a couple of 12-step groups. The 12-step community is really activated. And I'll happily talk to you offline about some of those resources. But also NAMI Westside has 3 peer groups that meet every week. So, and a couple of them are led by Elizabeth, who I think is still on. If Elizabeth, Elizabeth and Garrett, who's also on with us. If you guys want to say a couple words about the peer resources we have, because they've been really helping, and people have. Susan, I would really encourage your son to join as well. But go ahead.
And Darius, these would be very helpful for you. So listen to Elizabeth and Garrett.
Yes, well, thank you so much for that talk. And like you were saying, Tim, we have 3 peer support groups. So we have one on Tuesday evenings, one on Wednesday, and one on Thursday, because we find that staying connected is the best thing we can do right now. And as a peer, so I identify as someone with a mental health condition. I create that peer space with my co-facilitator, Garrett, who's also on here and is wonderful.
And so how do they find the link for that? And the link is the ID.
It's at NAMILA.org/support groups. And you can scroll to the bottom and there's a calendar right there.
Oh, Dr. Levander.
Oh, Dr. Levander. It's also on the chat. I put the link in the chat as well. So
thank you, Erin.
Yeah, I'll do it again too.
I wanted to share.
The tricky thing is using Zoom is hard. Not everybody can easily do it. There's videos on the NAMI page on how to do it. It takes time, but if you don't know how to do it, just over and over again. If you're here, clearly you can do it.
Hi, I wanted to share something. Is that okay with everybody?
Yeah, Garrett.
Okay. Hi, my name is Garrett, and I co-facilitate the support group with Elizabeth. It's been such an honor to be associated with NAMI, and thank you, Dr. Eric Levander, for your speech tonight. It was very interesting. I wanted to share that I heard a quote once, and it said, "The opposite of addiction is connection." And I think there was somebody in the support group with Elizabeth and I that recently was saying, I'm having the urge to use. I'm not so sure which support group it was that I heard this young lady say it, but she said, I'm having the need to use. And I said to her, that's the right time to add something positive to your schedule. When you have something that you look forward to, and you determine that was good for you, and it's something that is good, and you can put your positive mental attention to it, it will fuel you to the next level of your recovery because you're focused on something good. And I also enjoyed DBT, Dialectical Behavioral Therapy, and studying it. It's supposed to help people with BPD, borderline personality disorder. And one of the skills they teach is opposite to emotion action. So if you're feeling very, very, very depressed and you just want to hibernate, it might be good to get up out of bed, put some water on your face, and take a walk. And like Dr. Levander was saying, exercise is very, very helpful for people that have mental illness. And that's something that I have to remember myself more because I have to get more exercise in. So thank you.
Thanks, Garrett.
Thank you, Garrett.
Could I add something? Could I add something? My son is in a treatment program for his schizophrenia for a year in New Jersey. And he's with a group of 8 guys. And every time he said, I want to come home, he's coming home in July. I say, look, Joe, you're with 8 guys, so you're not isolating, you're alone, and you're with someone. So it's, in a way, it's better he's with people who understand his illness than being alone here. It would be harder and it would magnify his symptoms. So it's, when they're in a treatment program, I flip the switch that it's better for him. He's with a group of young guys and he is not alone. So that was, if you're
helping each other.
Right.
We are social creatures,
right?
And it's really difficult. I will say one difficult thing, a lot of people some people really do have a hard time connecting with people and stay isolated. But few people have told me that they enjoy this fact. It's hard staying by yourself, and it's important to have people around you who support you and help pull you along. As do organizations like NAMI.
You have been so helpful for all of us, Dr. Levander. So helpful. Any last questions here? Any last thoughts? Anybody want to share anything? Darius, these support groups we have with Elizabeth and Garrett would be really helpful for you. You can go online, Zoom online, and they would be very, and Dr. Xavier Amador is a really important author in the psychological field, and hospitals very often aren't very paternal. That is true. They kind of can help an individual regress, actually. You know, instead of feel protective, you can kind of emotionally regress when you're hospitalized. So I'm glad you're out, and I'm glad you're back home with your family. And please lean on us for support, Darius, please.
Absolutely.
So anybody else want to share anything or ask a question? Did you have a question, Darius's mom?
No, I just wanted to thank everybody, Dr. Levander, you, everybody that participated. It was great to have this group that share each other's feelings and fears and concerns, and it has helped me too. Thank you so much.
Great.
I hope it
I second
helps
that.
Darius.
Thank you.
Thank you.
Jessica Kligman has just raised her hand. Maybe this can be our last question of the night. Jessica?
Just figuring out how to unmute. Okay, hi. Thank you very, very much, Dr. Levander.
Sure.
I just have a little thing, which is I have a teenage son. He's in 11th grade. Already, you know, in the swirling of SATs and APs and, you know, college prep and college tours and things like that. And everything got upended, completely upended. And he's just feeling like he's lost his definition of himself. And, you know, his SAT, his PSAT scores, whatever, were really, really, really high. And everybody was saying the SAT is going to be great for you, et cetera, et cetera. Now the SAT was canceled and now it's modified, and now some schools aren't even bothering with it anymore. And he feels like he's lost his edge. You know, he's lost that competitive up that he had to get into schools. And he's you know, pretty down about the whole thing. On top of all that is that thank God he has a really great circle of friends, but, you know, except for seeing them online, he hasn't seen them face to face at all. So,
right. Not good, but about that he's not seeing his friends, but yeah.
Right. So, no, they can, you know, they hang out and play all the time together.
Sure.
Online, but his birthday's coming up, and in a few weeks, and we were talking to him about, you know, a drive-by thing or whatever, or, you know, I don't know, a million ways to be creative about this. And his feeling was he doesn't want to see them in real life because it'll make him feel worse. It'll just feel awful to see them and not be able to hang out with them, or not be able to, you know, pat them on the back, or, you know, or even stand closer than 8 feet, you know?
Right.
So I don't know.
Is your question, what do you do about his birthday, or how do you deal with the stress of being
it's a whole big picture. It's hard to get him out of the house to go for a walk or anything like that. He's just very isolated, self-isolated, and
although he's my guess
depressed.
is he's connecting with other boys on Discord, so
yeah,
there is that. But, you know, you know, I was talking about, really, there's a number of things that are going to be important with your son. First of all, just acknowledging that his feelings are real, really providing with him a sense of, you know, a historical perspective can be helpful. I mean, we will get through this. I mean, I think the thing that I really go back to for myself is World War II destroyed the infrastructure of Europe, destroyed. Dresden was, if you read Slaughterhouse-Five, like pummeled.
Yeah.
And we will get through this. We will rebuild. The people who survived World War II and had their educations disrupted, destroyed, are now our senior citizens. And they're doing fine. Germany did all right. France has done pretty damn well. And so I think it's really important to take a realistic, long perspective and realize we're going to get through with this. And support them by asking them encouraging questions and helping them understand this situation, validate his feelings, tell him it makes sense that he's feeling this way. And at the same time, maybe he'd enjoy a Zoom call or going to a park and seeing them from 10 feet apart, everybody spread apart.
I know. He said no. He said no.
Then that's, and then, you know, and he may change his mind at the last minute. So
yeah.
It's really tough to say, but not to needle him and push him and to say, dude, you're wrong. And help him express his feelings and you know, just be there and be more patient with him. There isn't a way you're not gonna like go like that.
Wouldn't that be great?
Wouldn't that be great?
Right. All right. Thank you.
You're welcome. Good luck.
Can anybody hear me?
Yes.
I want to thank you, Dr. Levander, for giving your time, this wonderful talk. I really appreciate you giving us this time and that we were able to record it. And with your permission, we will put it on our website because it will be a very timeless talk. Because this might last a very long time, so people can go back and review it and have access to it. My computer is frozen, so all I can do is hear you. I can only hear you. It's my computer completely froze. But I want to thank you so much for offering your time to us this evening.
My pleasure.
Thank
Thanks
you.
a lot, Dr. Levander.
And
I wish
thank you so
everybody
much.
be safe and try and stay sane.
Yes.
Yeah. You too.
Thank you so much. This was wonderful. I wish we could applaud. We're applauding in cyberspace.
Yes, everybody stay
Thank you so much.
Stay connected and
Stay connected.
and stay protective of yourself.
And try not to resort to almonds.
Janis. Bye, Janis.
Be safe, be well, everyone.
Thank you.
Bye.
Thank you.
Bye.
Bye-bye.
Thanks again.
Thank